Got a reassuring update on Cam Skattebo's injury and treatment. Let's break down the diagnosis and what the data say about his return. Here is the right foot. The ankle mortise is a socket formed by the distal tibia, its medial and posterior malleoli, and the distal fibula, which makes up the lateral malleolus. These structures together grip the talar dome, the ankle's main weight-bearing surface. Stability depends on these bones, the medial deltoid ligament, and the syndesmotic ligaments that tie the tibia and fibula together. Ankle fractures are generally categorized by how many malleoli are involved. A unimalleolar fracture is when one side breaks, then a bimalleolar fracture where both sides break, and then the worst is the trimalleolar fracture, which adds the posterior tibia, and this has the highest instability. In Cam's case, he sustained a fibular fracture, which is this bone here, with a complete deltoid ligament rupture, and that's a rupture of this complex here on the medial side. When you have a fracture of the fibula with the deltoid ligament rupture, that is a bimalleolar equivalent fracture dislocation. So even without a medial malleolus break here, the ruptured deltoid ligament removes the medial restraint, allowing the talus to dislocate and widen the mortise. Open ankle fractures, which is when one of these bones break through the skin, only make up for about 2% of cases, letting you know just how rare this injury is. And of course, they require urgent surgery. We know that Skattebo's surgery occurred within 12 hours of the injury, and it does require IV antibiotics to reduce the infection risk. In this pattern, the syndesmosis is injured in roughly around 30 to 60% of cases. After the fibula is fixed, surgeons test that syndesmosis, and during that same surgery, sometimes they'll add screws or a suture button, also known as a tight rope, if instability remains. Also, after surgery, athletes can develop osteochondral lesions on this talar dome, seen in maybe around 20 to 40% of high energy ankle fracture dislocations. They're usually comprised of cartilage or bone fragments that can cause pain. If pain persists, sometimes a follow-up MRI might identify a lesion, and surgeons may perform another arthroscopic procedure. Recall, Chris Godwin had a second surgery that likely addressed a similar cleanup around 3 to 6 months post-op. The 6-month timeline is realistic, though optimistic. NFL data show operative ankle fractures average around 6 to 8 months to return, with about 70 to 80% of all players making it back. Full production can take anywhere from 12 to 24 months. Let's wish Cam Skattebo safe and speedy recovery.